Hello and welcome to today's webinar on autism and mental health. We are children and young people wellbeing practitioners, and we are trained to work with young people who may be having difficulties with low mood or anxiety, and parents of children who may be feeling anxious or be experiencing behavioural difficulties. We are part of Southwark Child and Adolescent Mental Health Service. Today you will learn about guided self-help, where we teach tools and techniques for you to try at home, in the hope that they will help you when experiencing difficult situations or feelings. In today's webinar, we will explore mental health difficulties in autistic children and young people, as well as exploring helpful tips that may support you. Autistic young people may experience anxiety and depression. This can be presented in the home, school, and in the community. This can occur when in an environment with loud noises, a crowded place, or in places with high-level demands, for example, exams. Many times, autistic children and young people may express their feelings of anxiety and depression by displaying behaviours of concern such as hitting, screaming, irritability, and throwing things. Autism is often linked with other conditions. Where one or more conditions coexist, they are called comorbid conditions. Approximately 40% of autistic people have symptoms of at least one anxiety disorder at any time, compared with up to 15% in the general population. Depression is an extremely common mental health problem experienced by autistic people, and it increases with age and higher IQ. According to Webster's Dictionary, the definition of the word comorbid is as follows: existing simultaneously with and usually independently of another medical condition. Comorbidities are indeed more common in autistic children and young people than in the general population. Anxiety is among the most frequent occurring condition in ASD, affecting up to more than 50% of individuals across all age groups. Among anxiety, the most frequent is specific phobias, affecting 30%, followed by obsessive-compulsive disorder and social anxiety, affecting 17%, and general anxiety, affecting 15%. It is important to remember that autistic children and young people may struggle with the following: recognizing that they are feeling anxious, letting you know that they are feeling anxious, and knowing how to cope with anxious feelings. Anxiety can present differently in autistic children. This can present as behaviours of concern, such as shouting, screaming, kicking, crying, becoming more withdrawn and quiet, seeking more attention or remaining close to a parent, repetitive questioning, difficulty sleeping, and reduced appetite. Autistic children and young people can have high levels of anxiety. Above is the analogy of the bucket overflowing. When levels of anxiety get too high, it can result in the anxiety overflowing and result in inappropriate behaviour. Autistic people sometimes experience low mood and depression. These feelings can become more common as children get older. Experiences of chronic anxiety over time can lead to feelings of sadness and depression, which is one reason why a mixture of anxiety and depression is common. Autistic children often have low self-esteem. This could be due to receiving more negative feedback from others, being excluded from social activities, struggling with friendships, feeling different, struggling to generalise across situations, and finding it hard to understand their emotions. Low self-esteem can sometimes lead to problems such as depression. It can sometimes be hard to spot depression in autistic people because some features of their neurodevelopmental condition can mask depressive symptoms, and many can find it difficult to understand and communicate how they are feeling. It may also be hard for autistic people to seek help for depression because any kind of change can create feelings of anxiety. Some more specific symptoms of depression in autistic young people can include self-injury, weight loss, loss of interest in favoured leisure activities, deterioration in social and self-help skills, physical agitation or slowness in movement, persistent low mood, decreased concentration, changes in appetite, sleep disturbances, change in vocalizations and speech, aggression that does not match the situation, and withdrawal. It is important that your child has plenty of opportunity and support to engage in activities that they find meaningful and enjoyable, and to build trusting relationships. Make good behaviour more likely whilst also increasing self-esteem. This is called positive reinforcement and is the most effective way of changing behaviour. It can be useful to make positive comments and to praise your child to help them through a difficult situation. Autistic children often receive negative feedback from others, and so praise and encouragement can be really important to raising your child's self-esteem and mood. Autistic children have difficulty with abstract concepts such as emotions. It can be helpful to name emotions such as sadness out loud, in your child or in other people, books and TV. Model emotions yourself and use picture cards or sign language, particularly if your child has little or no words, to help your child name their feelings. Some children who have higher verbal ability might like to use post-it notes, signs on the doors or text messages to communicate their feelings to others. Another way to do this is to use a rating scale, for example, a traffic light system or a visual thermometer. For example, number 1 or a green light meaning I am calm, number 5 or a red light meaning I am extremely anxious. Many autistic children show a strong preference for routine and structure and become anxious when they do not know what is going to happen. One way to make daily life more predictable for your child is to create a visual schedule. This will help them understand what will happen during the day and therefore reduce anxiety. You could also use a whiteboard to draw or explain what is going to happen. Make a daily plan using a visual schedule with your child to help them to feel more proactive and motivated during the day. Encourage your child to engage in activities that they find enjoyable. You could schedule time for these in a predictable and consistent way using a visual schedule. Giving choices may also help your child feel more in control. Other general enjoyable activities you can encourage your child to do are taking a bath, listen to music, play a game, do something active, go for a walk or do some arts and crafts. Relaxation activities can help to counteract the anxiety response because they send messages to our brain and our body to tell us to calm down. Relaxation may include allowing your child to have quiet time, or it could involve your child doing an activity that they like, for example going for a walk, reading, drawing or having a bath. Other activities that might help your child to relax include controlled breathing. This looks at focusing and controlling breathing patterns. You breathe in for 3 seconds, hold for 3 seconds, breathe out for 3 seconds and hold this for 3 seconds. You can repeat this for a few minutes. Muscular relaxation looks at tensing and then relaxing muscles, keeping your breathing at a comfortable pace throughout. Focus on how this feels. Autistic people can lead a healthy, happy life by identifying what already works when the right support and adaptations are in place. We do not want to change autism, but embrace your child's uniqueness and support them when experiencing mental health difficulties. For more information, please refer to the following resources provided. The Southwark Information, Advice and Support Team offers support, training and advice on topics including communicating with schools and other agencies, transition from primary to secondary school, and how to request for an education, health and care plan. Please keep an eye on our website for additional web seminars or workshops. You can also refer to our webpage for more resources. Have a look at our webinar on understanding ASD. Thank you so much for listening today. Please keep an eye on our website for additional